glucose. Blood sugar is too high. Glucose is the main source of energy for the cells in your body, and insulin, a hormone made by the pancreas, helps glucose get into your cells to be used of energy. It is so much words that are stated there, but Dr. will help us understand what is this chronic condition, what is glucose, what is the hormones, and what is this that are involved into it. But later on also we'll dive in a conversation on hypertension, which is also high blood pressure, which they state that is when pressure is in your blood is too high, 140 to 90. It is common but can be serious if not treated. Dante Marks, I believe in the next few minutes the guest will be here, and I believe you can just make a look. I think he's arrived. So things that increase the risk of having high blood pressure include older age. Ukiwa mzee hivi kunaanza kuona hatari, then genetics, being overweight or obese, not being physically active, high salt diet, drinking too much alcohol. So lifestyle changes like eating a healthy diet, quitting tobacco, and being more active can help lower blood pressure. Some people may still need to make or to take medicines. So these are kind of conversations that we need. And of course, we've not embraced diabetes and hypertension in a long time. We've always been focusing about other priorities, matters health, but now diabetes and hypertension also matters. So today on the conversation, we'll delve into that and understand the spaces on hypertension and diabetes. So we also are marking Lupus Awareness Month, which was celebrated on the 10th of May, actually a couple of days ago. So we're told that May is Lupus Awareness Month. Rally your family, friends and community to raise funds and awareness of the invisible physical, emotional and financial impact of lupus. Join us now, even as we celebrate this lupus, to make it visible to many. Haijulikani sana, but even as we mark this, do we understand the context of lupus? What is this and everything? So the color that we celebrate this lupus is purple. So we are clothed in purple. Everyone now gets to the community, gets to the friends, and really understanding the elements of lupus. As well, if you're out there and this is a kind of conversation that you want to involve yourself in, cheza kama wewe. Send us your feedback on the context and on what you'd like us to discuss in Matters Health. So we've dealt on mental health, which is a wider variety and a wider topic, but also we'll have an engagement on lupus to really understand awareness itafika home namna gani. So I'd like to just give you an insight on what are the symptoms of lupus. Maybe kuna moja kati ya wenzako marafiki wana ugonjwa huu, you'll be able to assist in one way or the other. So these are some of the experiences that we go through. Pain areas in the muscles, and of course pain circumstances occur while breathing. Ushaenda kupumua, like unaanza kusikia ni kama viungo vyako vya mwili vinahisi uchungu, and there are some places when you breathe. Most of it occurs around here. You breathe in so hard, then some of the areas in your body is gonna feel an inconvenient. So the whole body now, anemia, fatigue, fever, or malaise. So at the mouth, dryness or ulcers, mostly around these particular areas, hapa kwa lips. So what about the skin? So we have the red rashes or scaly rashes. I believe we know these kind of things that happen. Utadhania ni goosebumps, but perhaps inaweza kuwa ni lupus that is coming in. Now, what about the hair? So we have hair loss or loss of scalp hair. Ukiangalia nywele yako vizuri, there's a design that ukifanya hivi, ukichuna hivi nywele inakaa kama it wants to get off. So ukiangalia hiyo, it's not because we always speak about cancer, but it's not cancer. We might have an initiation of lupus as well. So these are the experiences that we go through, and I believe we'll also invite a conversation with the daktari to help us understand why are we marking and why are we creating awareness for this particular disease, without forgetting that cancer is still the leading cause of deaths right here in the Republic. And there's so many organizations that help cancer patients to get at least comfort and to get a space kuweza kujua kwamba it's not the end of life. Earlier last week we had a discussion on human immunodeficiency virus and AIDS. So we just wanted to create awareness because this lady has been battling HIV for the last 14 years. Hey, I wouldn't understand the challenge that she has been facing, but she says that her story is being used as a reflection of taste and understanding that there is a need for us to keep moving, and she's using this story as an advocacy and also to empower those people that have lost hope in their environments of HIV and AIDS. But at least I've mentioned some few things out here as far as your health is concerned, but the best thing, health is wealth. If there is a problem and you don't know the problem, just visit a hospital and ulize what is happening in your system. Perhaps inaweza kuwa ni shida ya damu, inaweza kuwa ni shida, you just need some water, inaweza kuwa ni shida that your body has a problem, the food that we take, saa hivi vile vyakula vingi vinatuathiri. So there might be many conditions that are coming in slowly by slowly. By the time we realize it, we are old enough na tuanze kuwa na matatizo mengi zaidi. But that is the way above. It is 23 minutes past 9 a.m. and the discussion is diabetes and hypertension awareness, really embracing this particular discussion. Allow me now to welcome our guest. Karibu sana.
Thank you.
Uko salama?
Uko salama.
Good morning.
Good morning to you.
How's the traffic out there?
Oh, Nairobi. Nairobi is a story to tell.
Indeed.
Yeah.
Indeed. And I believe weather haijakusumbua pia.
Haijanisumbua, but God is good.
Indeed.
Yeah.
There are people that are watching us right now.
Okay.
With the context on the weather out there, what is the best thing we can do right now?
Right now, I always say rain is a blessing. It's a blessing to us. So we can't necessarily view it from a negative perspective.
Indeed.
All we can do is just have our acts together in this form that we can keep ourselves safe from the kind of diseases that might come with the season, so that we don't perceive a blessing as a curse.
Indeed.
Yeah.
All right.
So,
what about what?
Like right now, I would advise, as we move around Nairobi, actually, because of the drainage issues, I would advise if people are moving around areas with traffic, this is the time to be punctual and very and wake up very early.
Indeed.
Yeah. People should buy their umbrellas. You know, Nairobians are
Indeed.
very
So what about at home? When we're at home, what are some of the things to consider in this cold weather?
In this cold weather, you know, a human being loves comfort in cold weather. So I will advise that, number one, we spend our free time, because you see, with this locked up kinds of weather, you will have a lot of free time in your house, because you won't be moving outside, you know.
Indeed.
And people will be stuck on their phones and on their TVs. These are the kind of conversations now they should be listening to.
But many people are making phone calls right now. This is a weather for two.
Weather for two. Anyway, even when they are two, they should watch it. Because I believe when we have free time, it's enough time for us to be very constructive with our time. We are in a generation where distraction is very common. Indeed. You know, because when everybody sits down, they are on their TikToks, not necessarily to learn anything new, they don't know, but we are just there merely for entertainment. We spend too much time with entertainment and we don't build capacity.
Indeed.
And you find that the youth are stuck in this scenario where they tend to feel like they are not valuable to the society.
Indeed.
But there is an equipment by which they can use to actually teach themselves even more things than what they learned in school. Yeah,
it's nice that you're here, and the conversation I hinted, it's embracing the fact that we need to have a conversation on hypertension and diabetes, which is your area of expertise. All right, so if you're joining us for the first time now, this is Peter Ndungu Wadulo. He is a registered clinician, vision bearer of Children of Light Ministries International, entrepreneur of Zoe Landscaping and Gardening Services, and we are honored to have you this morning. So let's begin with the conversation. Let's start with diabetes. There's so much to handle as far as diabetes is concerned, and many people are crying out there and wants to just have an understanding on diabetes. What will be our inroad?
Yeah, diabetes is, I'll first start by defining the origin or the bracket in which we will consider this disease. We call it a lifestyle disease. A lifestyle disease means that this disease came by the modification of culture and our social norms. You see, there is a way in which the prevalence of this disease is higher. Actually, it's increasing in East Africa. Kenya is recording the highest numbers of diabetes, and that therefore will lead us to ask the question: what's different in Kenya, in Uganda, and in Tanzania? Because there must be a factor that is causing this disease to be more prevalent in our country than in any other country in East Africa. And it has to do much with how we have embraced our culture as a society, because I feel like everybody is moving to the mindset that in this new age you need to catch up with certain even dietary techniques, like eating everything you see the West eat, you know? Like the West are eating, we are eating. Everybody is now glorying in KFC. Everybody is glorying in, and they're not bad, but when you make a habit of these things, we alter our bodies. I'm trying to be as layman as I can.
Yeah, sure.
so that everybody who's listening to me can understand. So we are glorying in things, we are glorying in cultures we borrowed, yet we don't sit to ask the question of what's the effect of these borrowed cultures. And the effect of these borrowed cultures are lifestyle diseases, you see? Because it was not a common occurrence back in the pre-colonial era to hear of people suffering from diabetes, you know? Because there was a kind of lifestyle in our diet that was embraced, which is not embraced today. Not only in diet, you can even get to the level of our practices of agriculture. I had a quote, I have not verified it, but if I get a chance to get to a lab, I will. I've had a research where people say that the level of quality in our fruits today is 7 times lower. The level of nutrient quality and quantity 7 times 70 years ago. So you ask, where is the disparity coming from? Why is this big disparity coming from? And I think it's also on the agricultural techniques that we have also embraced. So I believe everything goes back to how we view our food, because anybody who can control the source of food, their source of food, can actually control these diseases. These diseases are controlled from food. A wise person said it's better to prevent than to cure. You see? So if we want to have a more module conversation about these diseases, we must deal with where they are coming from. With where they are coming from. Another factor can also be our interaction with toxins through inhalation, you know, our hygienes with things. Because hygiene nowadays is not just to the level of bacteria. Now we come into contact with so many stuff, and in there are traces of metals we are taking into our streams. We thank God for the liver because it saves you from all these toxins. But the larger conversation must be embraced. If we are going to embrace industrialization, even in how we have embraced our social norms, then we must also embrace the mitigation measures. We must embrace standards to the things we are consuming. For example, diabetes now, if we have diabetes as a conversation, this is what wengi huku nje wanaijua as ugonjwa ya sukari. Now from the description itself, it can tell you where the problem comes. It comes from sugar that is unfibered. And
what does that mean?
When you eat your fruit has almost the same contents of sugar as the sugar you take. The only issue is the fruit's sugar is fibered, so that the body is able to absorb the sugar at the needed amounts.
Indeed.
You see?
Yep.
But the processed sugar does not contain the aspect of the fiber.
Okay.
So when it gets to your stream, it's absorbed as full, and that's why we get the high blood sugars.
Yeah.
Because when you eat fruits, you don't get that.
You can't.
You can't get that. But also,
what about the 7 times? The 7 times, lower.
The nutrient content.
Yeah.
I think that has to do with now when you go down to the chemical detail of whatever you're dealing with. Let's say like if it's a fruit, the vitamins in it, you see.
Okay.
But sugar per se will be very similar. If you want something sweet and you are not near a supermarket, girls love sweet treats, chocolates, sneakers, ice creams. The other only option you can have is a fruit because it can nearly give you the same experience.
Indeed. Someone is taking tea so often and perhaps needs sugar for that tea.
Yeah.
Do we embrace danger towards diabetes?
I would advise that if you love sugar, just take a little bit of it, or if you love it too much, use honey.
Okay.
Honey is a better option. Use honey because I feel like the sugar we are taking, especially. We really don't get a clear, I will call it what? We don't have a clear profile of what is contained in it.
Okay.
In the Kenyan economy right now is a very difficult one,
Indeed.
right? And anybody will buy anything for affordability,
Indeed.
not for quality.
Indeed.
Right now,
Indeed.
if you go to a shop and you hear that one kg of sugar maybe goes at 160 bob, and let's say we have a comrade who wants to take tea with sugar. So this comrade will be forced, let's say he wants a quarter.
Yep.
He will only have to buy the sugar not because of the quality. He won't go and say, do you have the one for 200 shillings? He will buy because of the convenience, you see. And convenience is now our danger point because
Indeed.
we are now interacting with things that are harming us.
Indeed.
For the need of convenience. And you can't blame people. You can't blame people, but what you can give them is wisdom. You can give them alternatives. Because if you can't control it, then you can at least control some aspects of it.
Indeed.
By you actually being disciplined to a certain level in dealing with certain things differently.
You're
so
right.
if, for example, you're taking a cup of tea and you want to use sugar. Why are you using 5 tablespoons?
Indeed. Why?
Why are you using 5 tablespoons? You'd rather buy honey, you see. And if you love sweets, you start an attribute of replacing habits. Like instead of taking processed sweets, you use at least fruits.
Kabisa. All right. So, which is the conversation that is growing public health concern right in Kenya. You mentioned something about the statistics and with the prevalence of around 3.1% in adults. The International Diabetes Federation estimates 813,300 adults in Kenya have diabetes. And this number is expected to increase as the population ages. While there's significant awareness of diabetes, a substantial portion of cases remained undiagnosed. So before we get, we just a touchline on the statistics, but now there is this also aspect here, 2 types of diabetes. Please share with us the difference. Kuna hii ina affect watoto na wazee ama it's all the same?
Yeah, so there are first 2 categories of diabetes. There is mellitus and insipidus. Then you get to mellitus, the one now that has type 1 and type 2. I'm more detailed on mellitus than insipidus. So the type 1 is the one that's more common in kids. In affect what we in Anzanga it's more common from childhood. Now we call it insulin dependent. Insulin dependent. Actually, if you know some kids with diabetes at a very early age, they depend on insulin injections on a daily basis, right? It's insulin dependent because during the embryology of the child, some things, some aspects of the body are not well developed. You see. But now type 2 is sort of acquired. It's sort of acquired. It's sort of acquired because it gets people in either middle age. We used to say these diseases used to come at old age. Nowadays, they are presenting themselves quite early. I had a teacher who used to say diseases don't read books. So if they say a disease is prevalent among the old, she says if culture changes, those diseases will also change with culture. So these diseases are also here in our 20s. We are now hearing people we are hearing people with diabetes type 2 in their 20s.
Indeed.
We are getting people and if you observe some things in their lives, you'll see the things that have been told.
Right.
Yeah, that's the major difference.
Indeed. So why do we have the conversation mostly or at an older age?
At an older age because of type 2. Type 2 is more common. Now, of the two diabetes, type 1, type 2 is more common. So the conversation we have of the older age is because of the prevalence of type 2.
Indeed.
You see? So because type 2 is more common among the older people. I was doing a research some time back, a very interesting research. There was an issue back before modern medicine came well into Kenya. People used to get foot sores. There are certain side effects of diabetes type 2 where you get something we call a diabetic foot. So people used to get foot sores, and these kind of wounds don't heal. So they used to think that somebody is bewitched if they got the side effects of diabetes because nobody had the language to call it diabetes. So this disease was more prevalent with old people. So they used to say that it was witchcraft because it was old people who used to get these sores. But it was necessarily just diabetes, and that's why you see knowledge enlightens us.
Wow, knowledge enlightens us indeed. It is 38 minutes past 9 a.m. and of course you've just given us an insight and a glimpse of understanding diabetes. Now if someone is out there has listened to some few things about diabetes but now wants to turn to another channel, before he does that, what is the first thing that comes in your mind when you speak about diabetes? With one word.
With one word, I will just say discipline.
Discipline. All right. No worries. So that is Wadul, of course, helping us to understand the glimpse from diabetes. We are going to take a short break. When we come back, we'll understand now the symptoms of diabetes and later on have an extension on hypertension. So don't go too far. This is the Morning Drift Health Drift Check.
Feeling like unwinding and calming your nerves down after a long week? I'm Nika Kala. Join me on the Nakala Report this coming Friday and every Friday at 8 p.m. only on Lookup TV. At Nakala Report, we turn the insanity into sanity and sanity into insanity.
Taarifa zinapochipuka na kutufikia papa hapa kwenye makao makuu ya chumba cha habari cha runinga ya Lookup, kwenye taifa, kwenye serikali, kwenye bunge, tunajitosa hadi kwenye sauti ya wenyeji ili kupata tu maoni ya wenyeji kuhusu masuala haya yanayochipuka.
Maana hii kitu inaenda kuumiza Mkenya kwa tax.
Hakuna kitu tunafurahia. Nothing. Absolutely nothing.
Sisi tunaumia, si ati tunaumia ile ya kiukweli. Juu maisha ni ngumu.
Na bila shaka tunapata maoni yao ili sauti yao ipate kusikika. Na watasema hili, waseme lile, watasema hiki, na waseme kile, almuradi sauti yao ipate taa.
Mambo ya mafuta tena imekuwa
ni changamoto zaidi kwa kila mtu wa bodaboda.
Uchumi ikikuwa stable, tunaamini mambo itakuwa sawa sawa.
Kwanza liko na ria wasa wa boda, mama mboga nini. Hawa sasa ndio wamefinywa zaidi mazuri.
Mpenzi mtazamaji, hii ni bunge la wenyeji.
How do you start your engine when it is time to drive? Are you a first-time car buyer or want to upgrade your wheels? Do you know your car brand? Is it powerful, stylish, or does it turn heads as you drive past? Well, let's get to know all about wheels on the Daily Drive Show with Ian Otieno as we review all automobiles inclusively, specs and powertrain, interior, exterior and pricing. Get on board with Ian Otieno for a dose of automobile scene on Lookup TV.
Welcome back. A conversation, diabetes and hypertension. How will we knock this diabetes? And if my father, my mother, my friend, my community has these conditions, what are some of the ways that I can deal with it in the best way possible? If you want to ask a question about this conversation on diabetes or hypertension, that is high blood pressure, send in your comments live on Lookup Television, Facebook and YouTube. Use the hashtag The Morning Drift or use the hashtag Health Drift Check. Karibu sana daktari as we continue with the second session. So what are some of the signs and symptoms of diabetes?
The most prevalent ones are polyuria. Well, let me try and explain them without the medical jargon.
Please assist us.
So the first thing, one of those major signs are frequent micturition.
Okay.
You keep on needing to use the loo for a number one every time. You see, there is constant thirst, such drying thirst,
Indeed.
Because of the constant losing of fluids. You see,
Indeed.
the constant losing, and then there is hunger. Njaa.
Unasikia njaa kila saa.
I'm telling you, diabetes. People with diabetes can tell you. Njaa to them is not a mere cliche. It's like it's a symptom. They are not okay. They are not okay. So these are the three most prevalent ones. When you notice that you oftenly just get hungry, even after you've eaten, you just feel hungry.
Within what range of time?
Like after like a span of 3 hours or 2 hours after you have taken, that's how quick they get hungry. So like after a span of like 3 hours, you've just taken like a heavy, not even a heavy snack. Like 1 to 3 hours, digestion takes longer.
I was counting. Because there are times that we feel you've taken tea at around 9 or 11, then by 3 p.m. or 4 p.m. you're hungry. Is that also an effect to consider?
Sometimes it's just culture. But you see, culture informs disease.
Okay.
Culture informs disease. That's why you should actually feel. I think it's healthier if you can. If you're an adult, it's healthier when you just have 2 meals.
Okay.
So it's not a sign of poverty to just have 2 meals. That's healthy for you. Your body will utilize that. But I find adults taking meals 5 times a day.
But nowadays when you eat two meals a day, unasikia ni kama umeisha mbaya.
No, mbona uishe, like una train your body. Ndio maana tuna deal na hizi issues at obesity, which also is a contributing factor to diabetes. Unapata watu wako gym every day.
Indeed.
The best kind of gym is just discipline your feeding habits. You don't need to get to the lifting of weights. You can just choose to discipline the stomach and say, we'll only be having, say, lunch and supper.
But now the food, the intake is the problem now. So because you wanna eat ugali, the ugali ya kitambo is not like now. You're eating ugali maybe at night 9 p.m. maybe. By morning you feel like you've never eaten.
Yeah, but you know, at least that's why they call it breakfast. Breakfast means you're breaking a fast.
Okay.
You last ate during supper. That's why you don't have midnight lunch.
Indeed.
So you're breaking a fast of almost 8 to 9 hours.
Indeed.
That's why it's called breakfast. That one makes sense. But
Okay. So there is also the aspect on vomiting and that there's aspect on chest pains.
Yeah.
Is that a development?
That's when it gets to complications. That's when we get into complications. So by the time you get into complications, definitely the disease is diagnosed.
Okay.
So we are looking at those symptoms which will tell a person who doesn't even know diabetes, a person who is not even educated in this disease, that if you see these things, these ones are more common. When it comes to chest pains, I would rather advise you first deal with your diseases we call URTIs, upper respiratory tract infections, because we say common things happen commonly. So you won't get chest pains and run to diabetes. You have to first deal with what is common for chest pains. But
of course.
Yeah.
Now, the one that was triggering much in history, having blurry vision. That na pia historia presence of ketones in the urine. Hebu explain hizo mbili, then now we shift to hypertension.
Yeah, blurry vision, ketones in the urine is more of a symptom. Blurry vision is more of a complication. So ketones in the urine will be detected through a test called urinalysis. Actually, in the frequent micturition, they will find ketones there, but for ketones to be in a diabetic, that is an alarming sign. That's a very alarming sign. Ketones are not supposed to be in urine. When they're in urine, that patient should be helped. They should be helped really quickly, because I think what can be traced most of the times is things like proteinuria, protein in urine, like sugar in urine, yeah. So, but ketones is an alarming thing, and also blurry vision. Blurry vision is a complication that comes with diabetes. It's a complication. The complication affects the anatomy of the eye. Yeah, and the physiology of the eye.
Sawa. Now let's shift gears now to high blood pressure, which also is prevalent to so many, and people want to discuss about this. So what are the elements of consideration when we're involving in these conversations, high blood pressure or hypertension?
Okay, I will answer this question based on my own research, because I've found it prevalent that many people who possess, or not possess, many people who have hypertension are also normally likely to be victims of diabetes. And I've always wanted to know what's the relation between these two diseases, and I came to understand that, yeah, they are actually very related, very, very related. Now, hypertension, unlike diabetes, might not really manifest through the consumption of sugar.
Unaweza kuwa na zote?
Yeah, watu wako na zote, wengi. Wengi. Kuna watu wanakunywa antihypertensives at the same time wakikunywa antidiabetics. They are balanced in both. Kisikia mtu akikwambia maisha ni ngumu, sometimes it's hard. Now those drugs are expensive. So like I came to understand that unapatanga there is a myth with hypertension that chumvi ndio inaleta. And I wanted to know why, because I think tukiwa shule tulifunzwa mtu mzee tunasemanga amekula chumvi. Mbona chumvi is now being related with problems na mtu mzee alikuwa anaambiwa amekula chumvi. And actually ukiobserve some cultures utaona chumvi is something that is considered to be healthy. So nilikuja ku understand that it's a consequence of actually even back to the sugar intake. It's the sugar that causes salt to be an enemy to the body. I wish I had the terminologies, but I'm keeping it simple in a way that somebody who wants to go and do their research, maybe through AI, they can go use my words as layman as they were. But actually, it comes from this lane of sugar that causes salt to now become a danger to the hypertensive. So you find out that kuna watu wengi sana wenye wako na hypertension, they believe that ni chumvi iliwaletea. Yeah. So hypertension per se, if you want to deal with this disease, number one, I would advise we change our social habits, especially how we interact with people, because kama hasira, emotions actually.
Okay.
Actually, if you do a research, you'll find out that people who are emotionally intelligent will rarely suffer from hypertension.
Walai.
Kwa sababu hypertension kuna some factors, kuna certain high levels of hormones hufai kuwa released to the body. Kuna certain high levels of hormones hufai kuwa constantly released to the body. So if you're ever angry, if you're ever pissed,
moody.
if you're ever moody, if you're ever sad, if you're ever heartbroken. Actually, nowadays it happen hata kwa very young people, man.
Okay.
Tunapata very young people. Yeah, unasikia hata young people are dying of stroke, because stroke actually comes as a consequence of hypertension. Young people are dying of stroke, man, because this is a consequence of tuna lack emotional intelligence to some extent. Now sometimes also you can blame them because again times are hard.
Very hard.
But I always say if you can learn to inform your heart with your mind, you can at least control certain diseases. Not all diseases are controlled through food, even our wisdom. Yeah.
So hypertension affects a significant portion of the Kenyan adult population, with studies indicating that around 25 to 28% of adults are living with the condition. If someone is out there na maybe anataka kujua perhaps kama kuna hiyo condition, so what are the signs and symptoms that are developing at an early age, or pia kama zishakuwa we get to know them?
One common one is constant headaches. You keep on taking painkillers every day. You're taking Panadols every day, and you keep on complaining. You get migraines. There is fatigue. Yeah,
it affects so many people. Like,
yeah. Now, actually, people should be careful of that. It's like an alert sign. It's an alert sign.
Anakwambia, I feel like niko na hiyo stuff.
Yeah, like kila jioni mtu amechoka tu, like they anashinda akikwambia I have a migraine. Actually, hata ukinotice nowadays in the evening, Kenyans don't like getting into matatus that are so loud, because they get those constant migraines. Now, ukiangalia, also, if you get a chance to get into the lives of these people, you'll get to understand what's bringing these migraines. So, actually, one of those major signs is migraines, constant headaches. Another sign is also fatigue, kuchoka. Unachoka hata kama hujafanya a strenuous activity. You've just merely lifted like a box, let's say like a distance of 100 meters, and you're panting your breath out. You keep on feeling like you're running. Also, there's also running out of breath constantly. Yeah. So, but especially hapa kwa fatigue and headaches sana. It's a very common sign.
When you're not eating healthy, and also you have migraine, so it becomes a crisis at the end.
Yeah, it can become a crisis to you. So I would advise, because these are also diseases that can be controlled when they are very early. So if you can make it a habit to go for a health checkup, it's just get your blood pressure taken, at least so that you can have a trend, so that if anything abnormal is observed, it can be handled early. Yeah.
So you've mentioned a couple of things about the hypertension, and what age does it affect? Ni watoto pia?
Again, the way my teacher said, books say the prevalence is from 40 years to between 40 and 60 years.
Teenagers wameondokea na youths.
But sasa venye nimekuambia, diseases don't read books. So they just strike through. Yeah, they will get you even in your 20s if you are not careful.
If I'm having these symptoms that you've mentioned, and I need to take a step to visit a doctor, what will I tell them?
I just think when you're going to visit a doctor, it's not a burden on you to really know what to tell the doctor. Just come and explain to the doctor your problem, that you've been constantly having these kind of migraines.
Indeed.
From there, the doctor knows exactly what they're supposed to do. to you. So if you're bold enough to go, because many people like curing these migraines with just a mere painkiller. So just get the boldness to go to a health center.
Veronica Njeri asks that for the doctor, can a kid be a victim of diabetes at an age of around 2 to 3 years?
Yeah. That's also likely to be type 1, because with kids we rarely diagnose type 2, but also I have also said you cannot rule out the fact that kind of food. Now, so if this disease is prevalent in somebody whose organs are already fully developed, you can imagine when they get to someone who is growing. Yeah, it can also affect.
All right.
Yeah.
Sawa. No worries. So Veronica Njeri, I believe a question is answered right there by Odulo right here. And of course, even as we embrace the hypertension, which is a significant health concern right in the Republic, so how will we be able to help patients that are into these conditions? So we're told that with a substantial percentage of adults living with the condition, while some individuals are aware of their high blood pressure, tunafaa tuende tutafute daktari. We ask these questions. Sometimes if the environment is not pleasing, let's visit the doctor. So if you're out there and really understanding the context on diabetes and hypertension, I believe this is the conversation for you. Ask all the questions that you intend to, and if you miss out this episode live, you can also watch it live on YouTube later on, or on Facebook, and to help you shape out the conversation na uweze pia kusaidika in one or the other. So we have the complications now. Nimepata hypertension, nimepata diabetes, and the doctor says that this will take some time before rudi normal. So how do we treat these diseases?
Number one, I'll start with drug adherence. I would advise drug adherence with so many people, because one of those problems we tend to have with so many patients is their discipline in drug adherence. You know, these diseases need ethics. They need ethics. So that's why you really need, if you really want to get well quickly, you have to come into terms with what you need to do. I feel like many patients mess themselves up when they, number one, lack the discipline to drug adherence. Now, also number two, after you've done drug adherence, also keep constant checkups so that when there is an improvement, the drug dose is reduced up to when you are now not dependent on it, because these diseases can actually live. They can actually live, and you can just modify your feeding habits. Yeah. Feeding habits. Yeah. Lakini sasa historia ya food inasinya sana because you're trying as much as possible to take the medicine, but on the other hand the food now is a crisis. So it means the medicine hata haifanyi kazi vizuri ama inaenda tu inakuumiza. Ni kama unajisabotage. It's like you're taking a step forward and then you're taking 3 backwards. You see? So like that's why I keep on insisting discipline is key. If you're going to do good drug adherence, also be very strict with your feeding. And I will actually even advise, if you struggle with your feeding habits, we are in an age of AI. You can just use AI to advise you. I see people use AI for every reason. So just use AI to advise you on how to eat. What is my working style? Yeah, and actually, I came to learn AI can even advise you to the level of your economic ability. Indeed. It can tell you what's the most healthy food for you. Yeah, like let's say if you have $1. Amazing. Yeah. We are in an advanced age where I think we should take advantage of what we have. So yeah, in the feeding area, I think the only thing we are missing is discipline, not information. Okay. Yeah. All right. So we informed about diabetes and we informed about hypertension, but there is that grandma out there that wants to, manze nimeugua for quite some time, na mimi ni kama sukari siwezi wacha sijui kutumia nini, which now inakaa kama indiscipline.
how they treat. So how will this person handle?
To that extent, mimi sasa hapa ndio I normally get to the mental part of a disease. Because I'm also a guy of faith, so I do believe as a man thinketh, so is he.
Is he?
And I feel like some of these diseases defeat us because of how we choose to perceive them.
Okay.
You see, if you already feel defeated, you won't give a fight. You even notice there are people who have come out of cancers at stage 4.
Indeed.
Simply because of their resilience.
Indeed.
So there is a even mental part about this disease. There's a way you have to have a mental assent to actually fight. To actually fight. Because I feel watu wengi hapo ndio, I think too. So that's why we should learn to encourage them. Go talk to your shosho, tell your shosho all things are fine. Shosho, you should tell them, if actually you are a Gen Z, go tell your shosho ataona wajuku. At least she has some hope in her heart afurahi. Hii disease haitamweza. But then it's serious. How you perceive something up here affects how that thing goes. I promise you. So at least send her, tell your shosho something nice. She will get happy, and when she gets happy, at least she'll have the strength to fight.
Yeah. All right. So the elevation is done, and we want now to understand. So future inakaa namna gani? The awareness is made, and the conversations are ongoing. You are receiving patients with this kind of disease. So what is the preparation room for all these patients that come to the hospital? What's the best advice that comes with it? Yes, amekuwa na ugonjwa huu kwa muda sasa, but there is the aspect now he or she wants healing, and pia to ask the question, na ni wagani wanaumia sana with the diseases? Ni male or female? So these patients are coming to the hospital, and it seems that they've lost hope, but you stand in a chance to give them that hope. So what is the best advice? Maybe they are watching us right now, they're feeling the conversation. So what will you tell them?
I'll say number one, like I've said in my previous point, the best advice I begin with is mental assent. Choose to be a fighter. Choose to be a fighter. Choose to believe there is a way out of this, because I feel like because of the many problems we face, we are easily downcast, and these are things that can be resolved. These are things that can be resolved. So if you carry, and then also number two, don't take too much pride. You know, there are people who pride in these diseases. They call it magonjwa za matajiri. Za matajiri. Unajua kuna sasa makolera za watu maskini. Don't take pride in these diseases. They are not something to be proud of, you know. Don't take pride in them, because again, when you're taking pride in them, you're owning them. And you might not, you might use them as your bragging rights, and it's a suffering. So there is a way. Number one, your mental assent should be that I can conquer this. The second thing should be, when you have a mental assent, you will have the discipline, as tumesema. But again, sasa, there is a question you have asked about prevalence in males and females. I think the prevalence has nothing to do with the bodies. I don't think it has anything to do with the physiology or the anatomy, or even if there is, I don't think it's such a big factor. But I think when, again, it goes down to the very simple details like our norms. You will find that girls are more dependent on sweets. Yeah.
As you proceed, Veronica Njeri still asks, secondly, the fact that I'm usually always angry and appeased easily by people or petty stuff. Does it mean I have hypertension? I do love eating, but it is a sign of hypertension. So that is one. And also ask the doctor, please, when I am supposed to go to the doctor to ease the suspicion of having hypertension, and does it have control, or I need psychological help too, because I'm always hyper? These are two questions.
I think what you need when you're actually ever emotionally unbalanced, let me use that, because any extreme of an emotion is dangerous. Too happy clouds your judgment. Too sad, too angry also clouds your judgment. There must always be a balance. So for balance to be achieved, definitely you're not going to avoid the psychological aspect of treatment. I think we should redefine what we call psychological approach of treatment. It's not going to see a psychiatrist because you're crazy. I think it's just to help you deal with those parts which cannot be dealt with uninformed. You see? So yeah, the psychological part is really important. She will really need to talk. She will really need to see somebody who can help her through those quick impulses, because I feel like how you react to people matters a lot to your health. Yeah.
So how you react to people matters a lot. We have 3 minutes to Veronica. Janet, I believe you've been answered in a very positive way, including to understand the hypertension and everything. But also, if you have further questions, you can also share with us as well. Then we'll create some time with Udulu to get you on board and feel the circumstance in a song and namna. You, as we mark Mental Awareness Month, you mentioned about this thing inafaa turudi bado kwa mental discipline. So because we're marking Mental Awareness Month, now share with us the feeling ya kuweza ku make sure that our mental status is perfect and is stable despite the challenging times ya ugonjwa yoyote ile.
I think when it comes to the mental aspect of things, I just think let us be very particular with the kind of information we consume. Let us be very, very intentional with how we spend our time and with whom we spend our times. Let us also be very intentional with the kind of associations we are making, because these are they seem very minor factors. My high school principal used to say, it's not the elephant that kills most people, it's the mosquito. You take the small things lightly, and they can really harm you, you see? So let us really deal with this part of how we relate with one another, because every problem comes from that.
So we have 20 seconds to go. I'd like you to just give us an invite on Zoe Landscaping and Gardening Services, as well as Children of Light. Yeah. Just with the very last words.
Yeah. So I'm also a founder of a ministry. It's a youth ministry right now, but our vision is bigger than that. Right. That's Children of Light Ministries International. I'm also the entrepreneur behind Zoe Landscaping and Gardening Services. I began that this year. It's all about life being preserved in beauty. Yeah, vegetation.
I think that is well. We'll create some time also to understand now the aspects on entrepreneurial, Zoe and everything, and perhaps kando na udaktari, what are some of the things that you do as well. So no, asante sana for making time as well. All right, it has been a pleasure. Health is wealth. This is the Morning Drift, and of course, thank you so much for all the engagements live across our social media platforms. And remember, the conversation is still posted there, knocking diabetes and hypertension awareness across all our social media platforms. Now, ladies and gentlemen, the conversation matters to you because we need a healthy nation, and of course, health is wealth. So every time as you wake up early morning, check out on your health. If symptoms persist, seek medical advice. And these conversations are somewhat therapeuticals, you know. All right. See you tomorrow as we embrace now Social Wednesday. My name is Moses Sokate. My director has been King Dantimax and the entire team for making this happen. Now, this is the Morning Drift.